We all live in the age of modern medicine and miracles. We've done the impossible. We've brought the dead back to life, we've made the paralyzed walk again, and we've even made diseases completely disappear. The World Health Organization states that we actually completely eradicated smallpox, one of the deadliest diseases known to man, in 1980. How did we defeat this beastly disease? Well, the answer is actually quite simple: vaccines. After extensive research and working in the medical field myself, along with other healthcare professionals, today I'm going to share with you many reasons why vaccination is actually a good thing, and I'm also going to debunk a common misconception that revolves around them. Despite eradicating one of the most deadly diseases known to man, some would say we are reverting to our old ways. We seem to be in the age of modern medicine and technology, yet people still continue to die every year just by not getting their shots. According to the National Foundation for Infectious Diseases, in the US, vaccine-preventable infections kill more people annually than HIV, AIDS, breast cancer, and traffic accidents do alone. This means that approximately 50,000 adults die each year from diseases that could have been prevented if they had just gotten vaccinated for it. Further, in 2015, the World Health Organization reports that over 130,000 people died from measles in the United States. And the measles is a disease that is preventable with vaccination. And this was 2015, this was fairly recent. So clearly there is still a common prevalent issue in our society with getting vaccinated and staying healthy. But why do people refuse vaccination and risk their lives if we have a solution to this problem? Well, there are many common misconceptions that keep resurfacing that people buy into. One of them I'm sure that you have all heard of, and if you haven't, I will explain it to you, but is that vaccinations cause autism. I too wanted to know why this belief revolves around our society. So I did some own research through the College of Physicians of Philadelphia, and I also attended a microbiology lecture last spring where my professor, Robbie Fisher, explained it to our entire class during a lecture. And so I'm going to share with you what I have learned and hopefully prove to you that this is a myth and that vaccinations do not cause autism. In 1998, a doctor named Andrew Wakefield and 12 other researchers posted a research paper claiming that they had found a link between the childhood vaccination for measles, mumps, and rubella and autism. After its publication, it went viral. This news was all over every single news station, and it terrified parents to vaccinate their children. After this outbreak, the next 12 years were crucial. Scientists studied this link between autism and vaccines very, very extensively. However, no reputable, relevant study ever confirmed these findings. In fact, in 2004, news got out that Wakefield, the primary scientist behind this research, was actually paid by attorneys to falsify data so that these attorneys could win their court case. This means that Wakefield actually falsified his scientific results on vaccinations and autism, and he was even banned from practicing medicine in the United Kingdom because of this. Despite this, Wakefield's work was actually very successful because he started a myth that would circulate for years, and he would cost the lives of thousands because of it, and he still continues to cost the lives of thousands. Despite common misconceptions, vaccinations are actually very, very safe. The U.S. Department of Health and Human Services documents all the stages a vaccine must go through in order to be administered to the public. First, they are tested for years and years in the lab. If and only if they pass these laboratory tests, then they move on to clinical trials, where it's tested in a tiny population of humans. And during these clinical trials, the FDA and the CDC work very, very closely to determine if this vaccination is safe, to determine what dose is the most important and the most effective, and how the immune system reacts to it. If and only if it passes these clinical trials, then it's administered to the public. But even then, every single batch is tested for quality and safety, and every single vaccine that's given out is monitored closely by the FDA and the CDC. Vaccinations are so closely tested and monitored so that they know for sure if they're safe for us, that it takes many years to even get them on the market. So if you're doubting vaccination because of its safety, don't. They're actually extremely, extremely safe. Not only are vaccinations extremely safe, they're also crucial to everybody's health. The CDC states that we are all at risk for serious diseases that could be prevented from vaccination. Not only do vaccines protect you, but they protect those around you, and they protect those around you that can't necessarily protect themselves. Believe it or not, we live in a society where there are many immunocompromised people. This means that their own immune systems don't work as well as others, and this means that they have to rely on other people to be safe and vaccinated so that they don't get sick. This also means that they can't rely on their own bodies for protection, so they have to rely on others around them to keep them safe. There are also people in our society that can't build immunity even if they would like to. I'm actually an example of this. I've gotten the chickenpox vaccination over 5 times now, and yet every time they test my blood for immunity, it's simply not there. I guess my body is incapable of making antibodies against chickenpox. But this means for me that I have to rely on others to stay vaccinated and to stay healthy, because if they get it, I'm going to get it, and I cannot protect myself with my own body's immune system against chickenpox. So I really rely on other people to stay safe. And I also work in the emergency department where disease is rampant. So it's really important to people like me and others who are immunocompromised. In conclusion, today I hope you have learned the importance of vaccination. I hope you also choose not to believe the myths that circulate around there about them. Vaccinations aren't just for you. They're for your future kids, they're for those around you, and they're for those around you that can't necessarily protect themselves, like me. So once again, I hope you have all learned how important vaccinating is, and I hope you will vaccinate yourself and your future families. Thank you.